Look around you. Anyone wearing any masks? Probably not. Anyone reminding you to wear a mask? Unlikely. Mask mandates are now a thing of the past. Fines for not masking up have been reduced or are now being removed altogether. COVID restrictions are being lifted across the world. The world is opening up. Countries are now making the transition to a pre-pandemic life. Restaurants and cafes are open. Cinemas and theatres are welcoming people while people are back inside the office. They are working not from home anymore, but from office. And then there's China's zero COVID policy. This is being implemented in Shanghai as we speak, where citizens are screaming to be heard.
因为所有的人，你都不晓得这个状态到底维持到啥个辰光。我总要把个标准，或者是讲有一个具体的说法。
All these people, as we've been reporting on WION, are revolting against harsh COVID restrictions, but at the same time, be it the United States, the UAE, Denmark, France, Spain, or even England for that matter, face coverings are no longer mandated by law. And that's a big story at this hour. In India too, COVID curbs are a thing of the past. While masks are advisable by experts, there is no penalty if you choose to go mask-free in public. Cases are, however, rising in the Indian capital, New Delhi in particular, and the schooling system is now at the center of this storm. While children head back to classrooms across the world, some for the very first time in most countries, kids are still unvaccinated, and that is a big concern for all of us. So the big question is, should they be wearing masks? There are already concerns that we've been flagging about a new variant of COVID-19, BA2, and now XE, and that's a new variant that's being spoken about. Is it more contagious? Are we being complacent about the COVID threat? Is COVID fatigue influencing government policies? On this special broadcast, we'll try and answer some of these questions with me, Priyanka Sharma. But the big question at this point is, when is the right time to unmask, if at all? So when do we let our guard down? Is COVID fatigue making us complacent? Can we throw away our masks? Are they even effective? To answer all this, joining us now on this special broadcast is our esteemed panel of guests. I welcome, to begin with, Professor Manfred Green, a professor of epidemiology from the University of Haifa in Israel. Also joining us is Dr. Richard Pinter, a lecturer from the Imperial College in London. And finally, also joining us is Dr. Sarah Pitt, a virologist from the University of Brighton in the UK. I begin this broadcast by thanking all of you for your time, and thanks so much for joining us on WION The World is One.
Thank you.
So my first question to you, I want to begin with Professor Manfred. As we understand, different COVID strategies are being deployed in different countries depending on the COVID cases that are currently rising. But the big question that I have for you is, have governments cracked to a certain extent what may work and what doesn't work when it comes to containing cases?
Thank you very much. I think that we're at a phase now which was predicted basically a couple of years ago, when we asked the question, how long would we continue restrictions and how long this would go on? And some of the answers were that when it gets to the stage where we are seeing the number of cases or the case rate being something like influenza and the death rate being similar to influenza, then we'll be reducing restrictions, not because it's not a problem, but because we've pretty much learned to live with it. And it's familiar to all of us that even though it might be effective, and in fact now there's good evidence that it would be effective, using masks and using social distancing to reduce the impact of influenza, this has not been done. And so I think that people basically now feel, if we're back to the stage where we're with an infectious disease which doesn't seem to be more serious than influenza,
Right, Professor Green, I just want to interject at this point, and I want to ask you a question that is on all parents' mind. We are sending our kids to school. We are not sure if in fact they are masking up while they're in classes or not. Should we be worried about the new infections that are currently on the radar?
Again, I think the people who are at highest risk are still the elderly and the people who have immunosuppression, although in the last wave we saw a lot of kids being affected. So again, it's what we would call risk management. Certainly, I would suggest that where possible, as long as the case rates are high in that particular area, I think that mask use is still effective. So I think it still should be considered as a policy. But I guess that's going to be something that's going to be tailored to the particular country and the particular situation.
Absolutely. Thanks for that, Professor Green. I want to take my next question from Professor Pinder, from Dr. Pinder. We've been talking about cases rising in some small pockets across the globe, especially in educational institutions and schools. Should parents be concerned in particular? We've seen on social media parents raising queries about should our kids be masking when they're in school, and if they're not able to wear a mask, should they be at home in case of a so-called outbreak or one kid testing positive. Several governments have also made masks optional now. Are parents' concerns valid?
Yeah, I think it's very reasonable as a parent myself to be concerned about what's going on. But we have to understand that actually, certainly among younger kids in particular, the risk is really very low compared to, just as Professor Green was saying, the elderly here are at much, much greater risk. And it's very easy, I think, in a lot of public health to look and sort of be slightly fearful of the things that we can measure very easily, such as the number of infections or the number of people going into hospital. But what we mustn't lose sight of is the longer term impacts that, keeping children out of education potentially has, and which we're seeing certainly here in the United Kingdom right now. I know, working in a medical school, working in a university, teaching, that having face coverings on is certainly inconvenient. It certainly, prevents some level of that communication going across for, much, much older students that I teach, and certainly in primary schools with much younger children. Keeping face coverings off is certainly has value. But the reality is that we have to balance that with all of the other consequences. And if it is a question between whether or not you wear face coverings or potentially close schools entirely, wearing face coverings, I think, is a relatively low cost to pay in the scheme of things.
Absolutely. Coming to you now, Dr. Sarah Pitt, who happens to be a virologist, who is now joining us from Brighton in the UK. I just want to take this next question from you. We've heard of newer variants of the coronavirus coming to light. This is something that's been discussed at large, be it the XE or the BA2. Should we be worried at this point, and what can we do to arm ourselves against the new variants?
I think we should be aware of the fact that the virus has not really settled down yet. It's still changing, and we're still seeing new variants. So what we have seen across the world is that the majority of the vaccines that are available are actually effective. I don't think we necessarily expected this, but when the virus, as the virus has changed and the new variants have popped up, the vaccines have been quite effective. But one of the key things, particularly with the Omicron variants that we're seeing, and Omicron 2 and the XE, is how infectious they are. If you don't do anything to stop the spread of the Omicron variant of the virus, on average, it will infect between 10 and 12 other people. That's a lot more infectious than influenza, where that's on average, it's about one person per infectious person, and a lot more infectious than the original version of the COVID virus, actually. And so if you take that into account, you then have to think what percentage of the population need to be vaccinated in order to use the vaccines to bring the virus under control. And we're up to, I think we should be vaccinating 90% of the whole world in order to use vaccines to bring the virus properly under control. And so what we need to do is try and stay ahead of all the variants, because if the variant becomes more infectious, the proportion of people that need to be vaccinated increases. And that's the thing we need to do at this moment, is take vaccination really seriously, and also understand that the virus hasn't really settled down. Therefore, the pandemic's not over, even if we'd like it.
Dr. Pick, I would just like to interject at this point. You're saying that the pandemic is not over. We need to keep looking at the virus. It still exists among us. Now, as I am, I'm sure as you are, we are part of different WhatsApp groups. There are parent groups. There's a lot of anxiety when it comes to the younger generation, the junior school heading back to school. We know that kids under 5 find it hard to wear a mask when they're in classrooms, naturally so. Assuming that cases spike, be it the XE or the BA2, should we be worried as parents? And should we be sending our kids to school?
Well, one thing you can do, as well as mask wearing, is make sure the school classroom has very good ventilation. That's very important. Something we've done here in the UK is we've installed CO2 monitors, so carbon dioxide monitors, and that monitors the amount of breathing in and out that's happening and the airflow through the building. So we know that the virus is spread, it hangs around in the air, and so that's kind of one of the time wearing masks. So parents, if they're worried, they could ask the school the question about the ventilation in the classroom as well as mask wearing.
Absolutely. Dr. Green, coming back to you, Professor Green, I want to take my next question and I want to focus on China's COVID management strategy, which has been, as we all know, making global news. What's happening in Shanghai currently? People are scrambling for essentials due to the zero COVID policy. What is the right approach for different governments as cases spike?
Sorry, I had my microphone closed. I want to just repeat again that I think that there's no one policy for the world. Each country has to basically gear their policy towards their own resources and the conditions that they have. So I don't know that we can be critical of another country. I think that we can learn from other countries. And I think that China has actually kept the disease rate very low and the fatality rate very low, which is a success story. So I think that if they feel that they are able to cope with a situation where they have this very severe limitation on activity, then that's a choice that they've made, and there's certainly a benefit, but there's a cost as well, and I guess they're doing that evaluation.
Well, look at the visuals that are coming to fore, I mean, on social media or otherwise. There are people screaming while they're in lockdown. A zero COVID policy, while it may be effective in terms of scrambling down on cases, but we have people scrambling for essentials. They're screaming to be heard, literally.
I think that, I think my colleagues here have indicated, there's a very high cost of keeping children out of school, and there's a high cost of keeping people away from work. So I think that children should be at school as far as possible. I think that we have to make every effort not to keep them out of school. And that means that we use whatever we use, but there is a price to be paid in the infection. But I think the price of keeping them out of school, in my opinion, is probably going to be much greater.
Absolutely. I think the big topic here is keeping kids out of school, if school should be shut down again at all, if necessary. Talking about this concept of masks for kids, I want to take my next question to Dr. Pinder. It's difficult to enforce masks for kids as a concept. It's even more difficult to enforce when they are younger, say below the age of 5 years. They are the most vulnerable population when it comes to COVID-19. They are unvaccinated. Are we being complacent when it comes to COVID-19 and other viruses or other epidemics that may arise?
Yeah, so, well, I hope by virtue of us having this conversation, we're not being complacent. But masks, certainly for under 5s, is very difficult to implement and to enforce and really to take people with you. And one of the key skills in public health practice is to be able to take people with you. The acceptability of what you're doing is critical, because it's one thing to have regulations and to have laws and mandates. It's another thing to make sure that they actually work. And I think this drives into this sort of question, what works and what doesn't. And as you've heard from the rest of the panel, it's very specific to certain countries, to certain situations, and to certain behaviours on the people that you're trying to sort of get to behave in a particular way. So I have, I totally agree with what's been said here, that we must send our kids back to school. There is a much longer impact which is going to be there if we don't get that right. And what is going to be the challenge on the policy side is deciding, well, which are the proportionate levers that we pull from the public health point of view, and what can we actually take the population with us. Among under fives, I've got 2 under 5-year-olds in my family. Very, very difficult to get them to wear the face coverings. And I think what you've got to focus on is the stuff that's going to give you the greatest impact at potentially the lowest cost. And certainly teenagers, certainly in high school type contexts, there is evidence that mask wearing is pretty effective there, where you have sufficiently high levels of circulating virus. And I think the key thing here is to not take anything off the table. Depending on what the behaviour is going to be, what the level of circulating virus is going to be, and what the impact of that virus is going to be, is going to hopefully direct a pragmatic response from public health authorities.
Absolutely. I want to now ask all our guests who are joining us on WION at this hour about this term that has been trending on social media, COVID fatigue. It has set in for sure. For you, me, our family members, our kids. People are wary of lockdowns and ever-changing mandates when it comes to government policies. Have we as a generation learned to live with the virus in the best way possible? I want to start with Professor Manfred Green.
I think the only way that we can learn to live with the virus is to be creative. For example, in the schools, I think there should be much more teaching outdoors. Get the kids outside, certainly in the summer months, and I know it might be not easy in the wintertime. But in the summertime, at least, get them outdoors and take the masks off. They should be able to see each other. In any event, I think that in the classroom, the teachers should not be wearing masks. That's a risk that's taken. But I think it's very disturbing to children to be taught by a teacher wearing a mask. So I think that we know that they're going to be risks. And I would agree that the under fives I would say should be pretty much exempt from it, because it's just too much of a problem to try and enforce it, and I don't think it's fair to the kids either, or to the parents. So I think that should be done. But I think we need to be creative. Lots of ventilation, lots more outdoor teaching, and I think that's in general in society. Get the restaurants and cafes out onto the sidewalk, and get people outside. I think that's going to be something that could be very beneficial, and I think it's happening. It's happening quite a lot. So I think it can be done.
Right, absolutely. Coming to you now, Dr. Sarah Pitt, I want to ask you this question, and I may have a selfish intake in this. We're all part of WhatsApp groups. There are messages coming by the gazillions every day about new reports, cases rising. Should we panic? And if at all we choose to panic, should we be heading to our pediatrician? Or should we be taking, say, containment strategies that work for the best of us? What's your strategy when newer variants rise as a virologist?
So my answer to the idea of living with COVID is to understand what we know about this virus. It arose 2 years ago, which in virology terms is brand new, and it's still changing. So panicking is not really a right thing to do, but being aware of the fact that the virus is still changing. As Professor Green was saying, we can be creative. There are lots of different responses that we can make to reducing the risk of ourselves and the risk that we pose to other people, bearing in mind that perhaps 1 in 3 people who have an active COVID infection don't have any symptoms. And that's kind of the theory behind mask wearing, social distancing. Socializing outdoors is a really good thing that you can do, because it just kind of spreads the virus in the air and it's less likely to infect other people. And so living with COVID means understanding this is a brand new virus, which we have to respond to kind of what the virus is doing. But panicking isn't really the right thing to do, because all the things that we've been doing for the last 2 years, we know that those are effective against any version of the virus, which is just being considerate of other people, understanding that it's spread through the air, so they're doing things which kind of stop us contributing to potentially to the spread of the virus through the air. And as I say, good ventilation in enclosed public spaces and socialising outdoors as far as it's possible, and just being aware of what's coming along on the track. And again, if someone's eligible for a vaccine and hasn't had it yet, then start your course of vaccination. That's another thing we can all do instead of worrying. There are active things which we can do, which I think probably helped make people feel a bit more reassured and a bit more in control in the face of a global pandemic that none of us have experienced, none of us expected to experience.
Absolutely. This is a pandemic that none of us have expected to experience altogether. Just a follow-up to that, Dr. Pitt, assuming that we are choosing to unmask, what should our decision be based on, depending on where we're living?
Well, I personally still wear a mask in an enclosed space. So if I'm on public transport, a train or a bus, if I'm in a shop, I still cover my face just in case I'm one of those people that has active infection but no symptoms. Some countries also are sort of encouraging people to take regular testing, and that's helpful because then you can be a little bit more confident about the way that you are one of those infectious people. And certainly, if you have any symptoms, which might be COVID, be really cautious about socialising and mixing with people particularly people who you know to be vulnerable. So friends and relatives who you know might be vulnerable to getting very serious disease with COVID, try and stay away from those people. And again, as I say, we all know what we can do. We can just keep taking those measures. And we really need to understand that we need to be considerate of other people. It isn't just about whether you do or not like wearing a mask. I don't particularly like doing it, but I do it out of consideration for other people, because I wouldn't want to be the person. If I got COVID, I might be fine, but I don't want to be the person that gave it to someone else and that person wasn't fine. So it's about being aware of each other as well as ourselves.
Absolutely. Just a final comment from you too, Professor Pinder, about is this the right time to unmask? What are your thoughts?
Well, I think the question is, if not now, then when? And you have to draw a line in the sand. And I think it's sometimes very easy as scientists, as public health experts, to sort of stand on the side and say that we have to protect everyone against COVID at all costs. The politicians are the ones who have to make those decisions. And it's very easy, again, for us to focus on COVID and then forget about all of the other things that we're not dealing with. Right now in the NHS, our National Health Service, our healthcare system in England, we have huge backlogs of operations, other elective diagnostics and procedures. And we have to make note and be concerned about all of those other issues that need sorting out. We can't look at COVID forever. But you've heard from the panel, I totally agree with them. We're here for much, much longer with this pandemic. It's certainly by no means over. And what we need to focus on is sustainable, acceptable solutions that we can simply message to people so that we can make the greatest impact.
Absolutely. I, at this point, would like to end this broadcast by thanking all our guests for joining us on WION with all their insights and views. I think something that I have deduced from this chat is that COVID is here to stay. We have to learn to live with the virus in the best way we know possible. Masks may not be here to stay, but we have to take the call for what works best for us and our families and children. We have to understand that children are heading to school, and if they are unvaccinated, they are still coming back to vulnerable populations, and we need to be cognizant of that. I thank all our guests for joining us on WION World is One at this hour. WION World is One is now available in your country. Download the app now and get all the news updates on the move.